Hello everyone, I'm Dr. Harita and I'm specialized in psychotherapy and counseling. Today I'm here to discuss a very important question which often crosses our mind, that is when to approach a specialist who is specialized in mental health. So is it normal for me to approach a mental health specialist or not? Let us understand that. We see often in childhood the most common problems, which are like the child is either being very cranky, notorious, sometimes very aggressive, sometimes the child might come across various problems like they are having less attention span, they have less concentration, they are highly aggressive. So all these problems are usually noticed by parents but often ignored. Sometimes we might feel, as a parent we might feel that this may not be a problem at all, this the child might be, a child, simply a child. So we often ignore such kind of issues. Coming to the adolescent age, in adolescence, that is especially in the teenage, there are a lot of changes which are happening inside the body, especially during puberty. So what happens is there are adolescents who often corner themselves around. They are not clearly aware about what are the changes happening inside their body. They are unable to talk it out with their parents or colleagues or friends. So sometimes what you see, the most common issues in adolescent age is they're having pubertal changes, they're having lack of concentration, and sometimes you see that they fall into various illegal or unethical practices, falling into wrong crowds. So these are common issues faced by adolescents. I'm a faculty as well, I'm a teacher as well. I come across many students who come up with issues like I'm unable to express my thoughts or feelings, I have less clarity about my thought process. So all these issues are easy to be understood and easy to cure, but until and unless when if they are not talked about, it is very difficult to cure them, which might later on convert into difficult issues for the children. So if you see in adulthood, what are the most common issues we come across is as an adult we tend to take lot of workload or different types of works. We try to handle them, all of them together, but we may not actually do justice to each and everything. So as a result we come across a lot of stress. We don't know how to handle that stress, and sometimes we don't even talk about it. So not only that, there are relationship issues. Okay, most of us, like it is very difficult for most of us to communicate with the partner, tell about how we feel, or what exactly understand about how other person feels. So because of that, there is a lot of gap or space between the partners. It's not just that, there are a lot of issues concerning sexual health, because in especially in India we don't talk about our intimate sexual life. So we don't talk to even our partner about what are our likes and dislikes. Because of that also there is a lot of space present between the partners. And it is very difficult to convince or convey what we are going through, especially in sexual health. So these are most common issues which are faced by adults. If you go to old age people are usually having issues like they're unable to express their thoughts, a lot of inferiority complex, sometimes emotional distress, and emotional overreaction. So all these things we can come across old age. So all these issues are very very easy to cure, easy to address, and once they are identified at a very early stage, they are very easy to cure and solve. Only thing is that you will have to come outside, talk about it, and talk to a professional. So it's very easy to cure. So don't wait. If you are one amongst these issues, one of a person who is facing this such kind of issues, it's always a better way to come outside and talk about it. Hope you will find someone to talk about it.